Morning, everyone. Good morning, Professor. It's good to be with you this morning. I'm here to talk to you about prevention and reflection on cancer treatment. I'm sorry about my voice. I had COVID, so I've been dealing with it. I'm so sorry. I lost my voice too in the process, but I'm better now. Just that my voice is still heavy, so I apologize for that. Assessment of the contribution of the exercise. Behavioral medicines is considered a priority as a first approach of treating cancer among patients reported to be in the hospital. Therefore, the non-pharmacological aspect of treatment is emphasized in managing cancer in patients cost effectively. Moreover, patients with cancer experience a lot of pain, which will require therapeutic options for management. The nurse prioritizes pain management to address patients during vulnerable conditions. Additionally, in behavioral medicine, the physiological aspect of treating cancer is considered by patient. However, patients should be conditioned mentally to make decisions and influence positive deliverables among patients. Evidence and peer review and implementation of Capstone. Educating communities about the role of health impacts through behavioral changes, develops context to assist patients in becoming aware of risk and cancer. Notably, information about the risk to patients is vital to influence change in society. In this case, the patient's environment is assessed and evaluated in a community to provide a behavioral approach to cancer prevention. Moreover, the experts emphasizes on patient training on a behavioral approach to cancer management through unupdated cancer treatment measures. Therefore, rehabilitation of patients is undertaken with nurse to support patients vulnerable to cancer alignment. In addition to psychosomatic medicine for cancer treatment offered to nurses, creating an improved working environment for nurses emphasizes engaged medical treatment. Existing knowledge application of cancer is applied practically by assessing the patient's outcome while improving the deliverables through a capstone project of cancer patients. However, concerns from the patients are taken through a scientific approach. Through a scientific approach offering care and treatment, family members and the patients are engaged in the implementation of feedback. Patient feedback is a priority in creating a treatment plan for the patient. Seeking to develop information that influences the treatment of patient is provided with the evidence-based approach treating cancer, assessment of prevention information and updated data on cancer treatment is the evidence-based approach to enhance quality critical care. Moreover, the medication on patient is assessed to identify the most effective through evidence-based practice. Successful leveraged healthcare technology. Healthcare improvement is provided with the patient and nursing consultative forum being highlighted by technology. Therefore, communication through engagement with the patient facilitates enhanced social support to understand the challenges and opportunities to addressing cancer treatment. However, the patient's interventions is necessary. The patient's intervention is necessary once nursing time has provided guidelines for treatment. Information is determined by the feedback from the patient for nurses to provide treatment to achieve critical quality care. In addition, communication targets improvement through an evidence-based approach to ensure data is captured and analyzed by the treatment for the treatment. Further healthcare treatments centered on the patient procedure is enabled with improved engagement for data analysis. Health influences of health policy on planning. Health policy influences the nursing centered treatment approach. Decision facilitates an ethical approach to treatment disease with the nursing team prioritizing patients. However, funds allocation that determines the experience of serving provision for cancer treat patients. Therefore, funding in healthcare system is considered essential for influencing critical care among patients. Capstone Project's implementation policy is emphasized by assessing previous treatment of cancer patients, which envision new treatments through data analysis, developing insightful comments with Capstone Project ensures the evidence-based treatment is implemented with the nurses. In addition, technology provides the content to accept theory among patients diagnosed with cancer. Therefore, developing critical care facilitated by technology reduces costs and improvement accessibility to cancer treatment. Explanation of Capstone outcome matching. The Capstone Project matched the outcome intended for cancer treatment. Therefore, information is collected through an evidence-based approach to support cancer patients with nursing using an improved decision-making approach. In this case, Ethical directives are engaged during the practicum to evaluate patient assessment and analytical data evaluation and prioritization and prioritize with the nurse targeting standard care to improve patient need. More so, best practice in more so best practice intervention is provided with enhanced communication between patients and nurses to deliver on the standard of quality medical provision. However, in incidents of communication barriers are evidence in the nursing practitioner dealing with vulnerable patients seeking treatment. Further, accomplishing the practicum provided knowledge and experience to assist nurses in seeking informed opinion to handle patients from different backgrounds. A quality working environment is considered a priority for nurses to improve the quality of critical care in cancer patients. Personal and professional growth through a capstone project and the RN to BSN program. Personal growth gained from using a capstone project is experience acquired to becoming a nursing expert, improved decision making to influence quality healthcare deliverables to consider a growth skill from the capstone project. In addition, there are lessons gained from engaging with patients by learning experiences shared to administer treatment. Notably, the relationship improves the handling patient while offering treatment to patients. Furthermore, performances, evaluation, and critical analysis provided for growth during practicum. Growth requires patience from a nursing intern seeking to provide quality care to vulnerable individuals. The timing for learning requires commitment among nurses seeking acquired information. The system of growth requires the nurse to learn decision-making skills in the examination room, therefore supporting recovery measures for patients diagnosed with cancer. More so, identifying systems in timing the patient seeking assessment and evaluating for cancer treatment during routine medical visits. Notably, overall performance improves under supervision, which is considered essential in seeking knowledge during direct patient engagement. Moreover, growth is influenced by the passion and determination of the nurse to acquire knowledge in practice. I hope I explained everything needed in this topic, and I really want to thank my audience, especially my professor. I thank you for all the feedback you have been giving me. I read all of them, and I'm going to use those feedback in furthering my education by the grace of God. Thank you, and have a blessed day.